Good morning. Hi, Mrs. Weinstein. My name is Capri Papalardo, and I'm one of the graduate students here at Hofstra University Center's Salzman Center Clinic. And today I'd like to thank you for bringing in your daughter, Jana. Hi, Jana. How are you doing today? Very nice to see you. I'm Capri. I'm going to be your graduate student therapist in training working with you today. Very nice. And to begin for today, again, I'd like to say thank you we'll be using this observation on the website called masterclinician.org, and it's very important for speech pathology students to attain these observations for graduate school and further studies, etc. So, I guess as an introduction and background information for our client here today, Jana is a 2-year and 9-month-old female here at our clinic, and she began her therapy in September 2016, and she currently has an expressive and receptive language deficit, and she receives her therapy in an early intervention group with a few other clients her age, around 2 and 3 years, and she concurrently receives occupational therapy and PT services along with her speech language hearing services, and that's about it for her background. Is there anything I can answer for you, Mrs. Weinstein?
Yeah, actually, can you just remind me why my daughter needs speech language hearing therapy? Like, what is expressive language disorder?
Sure, not a problem. We get this question a lot from our parents. So basically, expressive language deficit disorder is, I guess the best way to explain it would be to compare, do you have your zebra friends here? Very nice. All right, so expressive language deficit disorder can be compared, if we use this, the best way to explain it would be to compare to a typically developing normal child around Jana's age. So if we go on to discuss Brown stages of morphological development, a child typically around the age of 26 months usually produces a mean length of utterance of around 2 for stage 1 sentences, which examples of stage 1 sentences would be my hat, more please, or more goldfish. Now Jana here is doing an excellent job and being very patient, by the way. Thank you, Jana. Your daughter has a very beautiful smile, I must say. She's so sweet. You're doing a great job. Thank you so much. And Jana produces one-word utterances, which is a little bit below the norm, so she has some developmental delays. And she typically says things like hat, more, doggy, but we're trying to gauge her to say 2-word utterances, so that doggy, my hat, or more please. So, because she's a little developmentally delayed, that's why she has expressive language deficits, and that's why she's here today.
Okay, so what kind of intervention will my child be receiving today?
Sure. So the intervention we're going to be using today in our early intervention social group is going to be language stimulation. And now basically what language stimulation is this intervention technique. Oh, I see you've opened up the zebra. I'm so proud. That's so wonderful, dear. That's very nice. We can talk about our zebra right after we finish telling Mommy what language stimulation is. So back to our discussion. Language stimulation is a technique that encourages the child and it elicits the production of language through modeling, through temptation, and different kinds of techniques that we're going to get into in a little bit to help your child produce more language in a natural environment. Sure, so is there anything else I could ask for you before we continue?
No.
Alright, so then we're going to get started with our first technique today. There's 2 main techniques we're going to be discussing for the use of language stimulation, and these are going to be play therapy and conversational recast. So the first one will be play therapy. So Jana, I have a question for you. Do you like to play with bubbles? I'm going to show you. Have you ever seen bubbles before? Oh, can you say that a little louder? I really like that you made a production. Maybe I can hear a word. Let's see if we can get some words today. Ready? All right, we have a Finding Dory bubble toy. All right, here we go. Let's see. Did you say Can you say bubble? Bubble. I heard it closer to bubble. Bubble. Great job. I heard another b in bub. Can you say bubble? Getting closer. Let's try one more time. Ready? Let's see if we can do it again. So basically, what I'm doing now is we're using the elicitation of play therapy to produce and encourage Jana. She's very excited to see these bubbles, and typically it elicits the excitement from the child, and it's a very client-centered technique in a natural environment, so it doesn't feel forced to her. It doesn't feel like she's forced to come here. She's just having a good time playing with bubbles, and we're getting some speech out of her. So we're trying to elicit some expressive language. So this is just language that she's expressing herself. What are these? Bubbles. Bubbles. Ready? Let's try slowly together. Bubbles. Very good job. I think that's good for today, but you're getting closer, and see how Jana is improving, and play therapy